Hi, my name is Robert Popovian. I'm affiliated with the Global Healthy Living Foundation, as well as the Progressive Policy Institute and the Pioneer Institute. Well, I've been aware of Georgia Bio for at least a decade. I worked with their former CEO on several issues regarding healthcare. And then the person who invited me was Dorothy, who's affiliated and works with Georgia Bio, and obviously Maria, the current executive director. And, I think that patients are why we're here, whether we're healthcare professionals, pharmaceutical companies, hospitals, or any other institution taking care of them. It's all about patients. Without patients, our care would be meaningless. Their voice is needed in our debate for healthcare. So that's why I'm here, because it's about patient care. So I actually advocate for all diseases. There's not one specific one I advocate. I don't think a patient who has hypertension is any less sick than somebody who has cancer or vice versa. So all diseases matter. It depends on you as a patient. So as a pharmacist, I'm a clinical pharmacist, I believe that every patient has to be treated equally and every disease matters for that patient. Now, whether or not those diseases are equally administered or something else, that's somewhere else to debate. But for me, they're all patients that need to be cared for. Well, I'm a pharmacist, and then I went back to school and got a degree in pharmaceutical economics and policy, which is policy matters because it affects so many patients. As an individual clinician or a healthcare professional, you can care for one patient. But if you pass bad legislation or bad policy, it impacts millions of people. And I came into this world in the middle of the AIDS epidemic, in the middle 1990s. That's when I did most of my training. And as a healthcare professional, you saw the suffering that was going on. So I became very aware that we need to take care of patients. And personally, everybody has their own personal reasons why we're here. Besides my training, I've had family members who have suffered from cancer or dementia. And myself, I had rheumatoid heart disease when I was younger. So everybody has their own personal experience and why they're here. Well, what is good is that we're in a country in the United States that we have multitude of avenues to be able to access innovative medicines. That is not the case in most other nations. In fact, even though healthcare does cost significantly more in the United States, but we do have access to healthcare that other countries don't, even the developed countries. So that's the good thing. The hard part is the cost and the burden on the patients. We also, because of this system that we currently have that provides us this bounty full of innovation, innovative therapies, there's a lot of things that are hard on patients with regards to the cost of the healthcare, in addition to the models that prohibit the care to be provided to the patient. So that's what we need to improve upon. But we do need to have the incentives in the marketplace for us to have the innovation, because at the end of the day, when you become a patient, when you're diagnosed with a disease, diagnosis is super important. But what you're looking for is a cure. And that's why pharmaceuticals and biopharmaceuticals are so very important, because at, diagnosis is just the beginning of the journey. What's going to help you go through that journey and come out successfully at the end is the biopharmaceutical. It's not the diagnosis. As I've said all the time, as patients, we need to become better consumers of healthcare. It is important for us to trust our healthcare professionals. It is important for us to trust our physicians, the pharmacists, the nurses who take care of you, but you still need to ask questions. You need to ask and challenge them because they don't know everything. And as patients, we need to become also better consumers and not trust the system. For example, an insurance company is going to look out for the best interests of us financially. We need to do our due diligence to be able to get, just like we shop for a television set, to shop for better healthcare. And those are the things that I would say that we need to ingrain in our system into our patients.